Good morning, everyone. I'm Karen from Vermont. We were asked to share how Care Services helps people living with ALS and their supporters. We're hoping that between the three of us, we'll be able to provide you with a nice overview. Care Services helps individuals impacted by ALS through accessing services. It could be an ALS clinic, which you'll hear more about later today. It might be connecting you with peers through newly diagnosed programs, caregiver labs, or through a variety of support groups offered throughout each month. Care Services works with the community on advocacy actions. This means gathering our community to meet with our government leaders to gain support for programs needed by families impacted by ALS. And Care Services staff works to help families navigate the ALS journey, which could mean the healthcare system, home modifications, or durable medical equipment needs. Navigation really means finding a course to get where you want to be. We hope to help you do that. Of course, we do it because you share your wisdom with us and we pass it on.
I'm Lori McFerrin. I'm the Care Services Coordinator for Maine. I want to emphasize that Care Services staff are here to support everyone impacted by ALS. We appreciate that children might need a different approach than adults. And if so, we'll provide age-appropriate resources. We also understand that caregivers' needs vary depending on whether they are a partner or maybe an adult child of the care recipient. Our support efforts encompass family caregivers, friends, and the entire village that is there to support someone living with ALS. With that in mind, we want to welcome Lisa Smead to our conversation. Lisa is a family caregiver living here in Maine. Thanks, Lisa, for your willingness to share some of your journey with us.
Thank you, Lori. First, let me start with a brief overview of our journey. On October 14th, 2020, John was transported to a Boston hospital, and ALS had not been part of the medical diagnosis or discussion at that point. The night of October 14th, 2020, John was in respiratory distress and intubated. During that process, he coded, was revived, and since that night has been on a ventilator. 2 days later, he was given the diagnosis of bulbar onset ALS, ventilator dependent, and had a feeding tube. John spent 5 weeks at Brigham and Women's Neuro ICU, followed by 4 weeks at Spalding Cambridge Rehab Center, and as a family, we participated in their Vent-to-Home education training. On December 16, 2020, we brought John home. Immediately upon John's diagnosis, we started our Google search for resources and supports. We had no idea where or who to turn to. The search ultimately led us to Lori and the ALS Association in Maine. This is what the ALS Association has provided to our journey. A listener. She comforted us, listened to our story. She helped us put things in perspective, prioritize the overwhelming big picture, always saying, let's focus on this right now, and we can address the other questions and needs later. The association provided resources which streamlined our search. Some examples of this are wheelchair accessible vans and companies, ramps and the names of companies, an architect to guide changes and adaptations needed for our home so we could bring John home, equipment not covered by insurance, such as shower chairs, and connections with other families who had equipment we needed. We received the ALS monthly newsletter, which is full of connections, resources, and caregiver support. She helped connect us with the Midcoast ALS Clinic, and we were able to schedule a medical appointment for when we got home. We were informed of grants and financial supports available to families. She helped us network, explore challenges, made suggestions when we met with insurance questions, and continues to provide ongoing communication via phone and email, and reaches out simply to check in. She knows our story. I'm forever grateful for having made this connection. I don't feel there is a question I can't ask. The ALS Association has been our lifeline as we have navigated this journey. Today, we are 1 year into a journey that changed our lives forever. John was not expected to be with us today. He is, and we are grateful for every day. Thanks.
Wow, what a story, Lisa. Thank you so much for taking time to join us today and for sharing your personal experiences. We know that personal experiences from caregiver to caregiver and family to family and person to person are the most important connection of all. What do you think, Lori?
Lisa, your story is incredible. And one of the reasons why I was so happy that Lisa came today is that we really have a group of caregivers who need to hear from you and to know that this is not just a standalone service for folks living with ALS. Lisa, you and your family have done incredible things. I'm glad that I've been there to support you, but you guys make it work every single day. And with that, I want to kind of free you up. I know that you've got a few more minutes, maybe before John wakes up, and I want you to enjoy your morning, but thank you for sharing your story.
Thank you for letting me do that.
All right.
Thank you so much.